Hi, I'm Linda, the creator of information about arthritis. If you are new to this channel, don't forget to subscribe. Just click the button below and then click the notification bell to receive notifications of new videos when they are released. Also, don't forget to visit my website, where you can find out more about these terrible diseases and download free articles. This video is about how type 1 diabetes and rheumatoid arthritis are similar, as they are both chronic autoimmune diseases that have a significant impact on your life. However, they affect different parts of the body. First, I shall explain the basics of type 1 diabetes. Type 1 diabetes happens when your immune system attacks your insulin-producing cells in the pancreas. Therefore, you need a constant monitoring of your blood sugar levels. When you have diabetes, and you do not keep a constant eye on your insulin level, your blood sugar levels can rise dangerously high. The causes are unknown, however. It is thought to be a mixture of genetic and environmental factors, such as a viral infection. The onset of diabetes could be quick, as in my son's case. He was in the garage when suddenly my daughter-in-law Sarah to us that Simon, my son, just dropped down to the floor. If Sarah, my daughter-in-law, was not with Simon, we could have lost our son. So, it is very important to watch for symptoms that include frequent urination, which can have an effect on increased thirst. Unexplained weight loss, the inability to use glucose for energy, can break down fats and your muscles may become weak. Extreme hunger, you may feel constantly hungry and feel fatigued and weak, with a lack of glucose in the cells. Diabetes can also affect your eyes. You may have blurry vision, as high blood sugar levels can affect the lenses of your eyes. Unfortunately, when you develop type 1 diabetes, it is incurable and can involve the following. Number 1, insulin therapy. This can be administered by an injection or an insulin pump. Number 2, blood sugar monitoring. You should regularly check your blood sugar levels by using a glucose meter. 3 is a balanced diet. It is essential to go on a healthy diet. This helps with a balance of carbohydrates, proteins, and fats. Number 4, physical activity. You should do regular exercise, as it helps to control your blood sugar and overall health. But you must watch your insulin doses around your physical activities to prevent low blood sugar. And 5, continuous glucose monitoring. This device provides a real-time glucose reading. Rheumatoid arthritis, on the other hand, is an autoimmune disease that attacks the joint, which can cause inflammation and pain. Rheumatoid arthritis attacks the healthy synovium, which is around the joints. You must not ignore these symptoms, as they can develop into joint damage and eventually deformities of the affected joint. The causes of rheumatoid arthritis are uncertain, but it could be a mixture of genetics, environment, and hormonal changes. The common symptoms and signs of rheumatoid arthritis could be joint pain, which can affect both sides of the body. Joint swelling that develops inflammation. In the morning you may feel stiff, after not moving for a long time. With the inflammation, you may become fatigued, you may have a reduced range of movement, and with the flare-ups, you may have a fever. The diagnosis of rheumatoid arthritis includes your medical history, physical examination, and blood test. Also, you may have an X-ray or MRI scan. It will help if you treated your rheumatoid arthritis by keeping to your ideal weight, have a healthy diet. And, I know this is difficult when you are already in pain, but you should keep moving and do some exercises each day. The difference between diabetes and rheumatoid arthritis is that diabetes attacks the insulin-producing cells in the pancreas, whereas rheumatoid arthritis attacks your synovium, which is the lining of the membrane that surrounds the joints. Living with both diseases can be challenging, which can include multiple medications that could interact with each other. The rheumatoid arthritis symptoms of fatigue and inflammation could affect your blood sugar level, which means monitoring your blood level is crucial. You can benefit from exercise each day, but for rheumatoid arthritis, you should be doing low-impact exercises. This means walking, swimming, or going to a gym, which has a trainer that can help you with planning a program. A balanced diet can help both diseases, which need to control the blood sugar, also reduce the inflammation. There are a few things that you can do to help with the bad days. If you have been diagnosed with both type 1 diabetes and rheumatoid arthritis, there are some strategies that you can do to help that include. Number 1 is that you should be in regular contact with your healthcare provider. They can help with your medication and plan of action. Number 2 is to learn how to do stress management and get enough sleep, also a healthy diet. Number 3 is working with a physical therapist. They can give you a program to help you with your exercise, which will be tailored just for you. Number 4 is to find a support group near you or online communities that have people in the same position as yourself. And 5 is keeping a record of your medication, and if you have any side effects, this will help if you are worried. Both type 1 diabetes and rheumatoid arthritis are an autoimmune disease. With the correct medical team, support team, and lifestyle changes, you could manage both conditions. Remember that you are not alone. It is vital to speak to your healthcare team if you are worried about anything. I am not a medical professional, and this video is for information only. If you have any worries, you should consult your healthcare team. I hope you found this video helpful and informative. Don't forget to subscribe to my channel, and good luck, Linda.